Good afternoon, everybody, and thank you for joining us today for our insightful discussion on the intersectionality of domestic violence and sexual violence in the LGBTQ plus community. Individuals experiencing domestic and sexual violence face numerous barriers in reporting and accessing services for various reasons. These barriers can be even more pronounced for those that identify as LGBTQ plus. Just some housekeeping things that I would like to go over before we get started. We will try to leave a little time at the end for questions. So if you have any questions, you can place those in the chat and we will try to get to those at the end. I can't guarantee that we will have time, but we will try to get to questions. I also want to discuss that if anytime we have some sort of sensitive topic, we do like to encourage questions and encourage comments. However, we do ask that you remain respectful in those questions and comments. Today, we are joined by four professionals from across Texas who serve the LGBTQ plus community. They will discuss the specific barriers and challenges faced by the LGBTQ plus individuals, what needs to be done to address these issues, and how we can all contribute to reducing risk for violence and breaking down these barriers. Thank you all so much for joining us today. I'm going to introduce our panelists. First, we have Joey Jackson Streeter, pronouns he, him. He is originally from Milwaukee, Wisconsin, and relocated to the Houston metro area in the spring of 2021. Joey has 4+ years of experience working in the community. In 2018, he participated in the first cohort of Milwaukee County's Empowering Community Action Initiative, a program for LGBT plus people of color to get their foot in the door to the public health sector. He was also a member of Diverse and Resilience Intersectionality Among Men, where he served as an advisory member. He is currently a part of the AIDS United Southern HIV Impact Fund, also SHIF, Leadership Development Cohort representing the normal anomaly. Welcome, Joey. Next we have, and Johnny, don't let me mess up your last name, Johnny Argumedo. Did I say that right? Thank you. Joey's pronouns are he, him, his. Joey graduated from Sam Houston State University in 2019 with a Bachelor's of Science degree in Victim Studies. However, his career in victim services began a year prior as a residential advocate for a domestic violence shelter in Huntsville, Texas. Shortly after graduating, Johnny returned to his hometown of Houston to continue his career in victim services. Johnny was a child protective services investigator that then transitioned to an advocate for commercial child sexual exploitation. Today, with his experience in domestic violence, sexual assault, human trafficking, and immigration services, Johnny currently holds the title of Anti-Violence Program Specialist at the Montrose Center. The AVP program was created to provide services to LGBTQ plus survivors of domestic violence, sexual assault, human trafficking, and hate or bias crimes. Thank you, Johnny, for joining us today. Next, we have Alyssa Kelly. Her pronouns are she, her. Alyssa received her Bachelor's of Science degree in psychology with a certificate in women's and gender studies from UACL. Awesome. I went to UACL too. She began at Tony's Place as a volunteer in 2017 when she was coming into her own queer identity to connect with the LGBTQ plus community and find space for herself while also being able to give back. Since then, Alyssa has held various social work positions in Houston and in Austin before coming full circle back to Tony's Place as the program manager in 2022. Welcome, Alyssa. Last, we have Chloe Goldman, pronouns they, them. Chloe began their queer advocacy in college, leading an underground support group for LGBTQ plus students at their Christian university in Arkansas. They came back to Texas to join the fight for sexuality and gender equality and reproductive rights. After working in reproductive health, labor rights, criminal legal reform, and some more schooling on public affairs, they found a home at Equality, Texas. As Constituent Services Manager, Chloe works to support queer individuals and their support and to strengthen Equality Texas partnership across Texas. When not at their desk, they can be found running after their niece and nephew or thumbing through sewing patterns. I feel that about the niece and nephew. And to introduce myself, my name is Melissa Prentice. I am the Outreach Education and Prevention Director here at Bay Area Turning Point. So welcome everybody. Thank you again for everybody joining us today. We're going to go ahead and jump right in. So first, I would like to ask Johnny a question. Johnny, how do rates of domestic and sexual violence within the LGBTQ plus community compare to those in the heterosexual community? And what factors influence reporting rates among LGBTQ plus survivors?
Yeah, great question, Melissa. So my some of my job roles as the anti-violence program specialist here at the Montreal Center does include case management and direct client services, but it also does include me putting on community trainings, engaging with the community like this, and as well as training our partner agencies. And one thing I do like to start off with is just differentiating the terms domestic violence and intimate partner violence, just because a lot of people do use that interchangeably, but the law does define those differently. So one quick, easy way to differentiate the two is that domestic violence applies to those within the same household. Abuse, exploitation, and abuse can be verbal, physical, emotional. And then when it comes to IPV, intimate partner violence, it does mean current or former dating partners. So the main difference is DV is just anybody in the household. It can be among siblings, it can be roommates, and then intimate partner violence is those that were currently or formerly dating. Um, so we are seeing really, really high rates of intimate partner violence in this country across the board. We do know that it is an underreported crime, whether the victim identifies as male, female, or within the LGBTQ plus community. So I wrote down some numbers. So just bear with me. I just wanted to give everybody some accurate statistics. So we'll go ahead and start off with heterosexual women. So it is estimated that about 35% of heterosexual women have experienced some form of intimate partner violence in their lifetime. And like I said in the beginning, that does include verbal, physical, emotional, or a combination of any, in comparison to 29% of heterosexual men. When we go and look into the reports of bisexual women, that is going to shoot up to 61%, again, in comparison to 35% of heterosexual women. When we're looking at the reports for bisexual men, that is an increase from 29% in heterosexual men to 37% in bisexual men. And in lesbian women, we are seeing the highest number, and that is 43.8% of lesbian women have reported experiencing one form of IPV in their lifetime. And with gay men, it drops down to 26%. But we do understand that, like I mentioned before, it is an underreported crime, especially amongst men, no matter how they identify. And then with our trans community, it is reported that about 48.7%. So the trans community is disproportionately affected when it comes to reporting intimate partner violence. Um, and then I would also add that some statistics for sexual violence, again, we also do know that this is hugely underreported. Um, so the statistics for that would be that 80% of bisexual women and a little over 56% of bisexual men reported some kind of sexual violence, and that falls under sexual abuse, sexual assault, rape, even attempted. Um, and then for both lesbian and gay women, that percentage rises up to 60%. And then for heterosexual women, that is 53%, and heterosexual men, that is 29%. And when it comes to our transgender community, it is estimated that 1 in 2 transgender identifying people have experienced some form of sexual violence. Um, and like you mentioned, also some barriers to reporting that or even seeking services. It's simple. It's because society has made us believe that heterosexuality is the norm. So, with that being said, there's a lot of homophobia, biphobia, transphobia going on even in this day of age that we're in. So, that also deters a lot of people from not only reporting to the police, but also seeking assistance, whether it comes to victim services providers or any kind of medical care that they may need following an assault. Of course, the community does not have the best history when it comes to relationship with the police. Um, as we all know, that history with police brutality has been an issue since the very beginning when it comes to um, people of the LGBTQ plus community seeking assistance via law enforcement. And then, of course, just mistrust in the system, specifically those that are people of color within the LGBTQ plus community. It kind of also deters them from seeking justice.
Thank you. Thank you. That was a great response. And yeah, I mean, it's really it baffles me how disproportionate those rates are of domestic violence and sexual assault amongst the LGBTQ plus community compared to the hetero community. And I mean, and also those are only reported numbers, right? Those aren't even necessarily the most accurate numbers. That's just what's been reported and determined through organizations like all of ours that collect these kind of statistics. So thank you for sharing that. Next question goes to Chloe. What unique barriers do LGBTQ plus individuals face when seeking support or legal action against sexual and domestic violence?
So a lot of them are going to sound similar to the barriers that everyone faces when seeking assistance to deal with domestic or sexual violence. But for queer people in places that are not hospitable, so for example, Texas, you're going to have the added layer of, if this is a religious organization, are they going to be affirming? And I mean, unfortunately, a lot of the organizations that serve people experiencing violence or that shelter people who are escaping violence or abuse, a lot of them are religious founded. So you have that issue, you have the availability of resources just within your area because Texas has the largest rural population in the states. There are just a lot of people that are stranded in places without a lot of options. And so when there are fewer options, there's a greater likelihood that it won't be amenable to your identity. There's also the issue of legal protections for survivors of domestic violence, sexual violence. They vary state by state. So there are some states, I think New York being one of them, that define domestic violence or IPV as something between a man and a woman. So it's not just marriage that is invalidated in law, it's also abuse in general. And then you have, trans people being excluded from shelters. That is unfortunately very common. You have like Johnny mentioned, people's previous experience with organizations that might otherwise help them, where they've either experienced discrimination, they had negative experiences with the staff who might not have dealt with a queer person before. And so there's a wide range, and any barrier you can think of for anyone seeking assistance, there's probably one or two steps beyond that when it comes to queer people.
Thank you for that. And I mean, I'm sure that's one of the questions that we're going to get to, but for those that aren't used to working with people in the queer community, what recommendations would you have for those folks?
Yeah, so I would say when possible, put queer people in charge because cultural competence is something that's really difficult to build as an individual. But if you're bringing in people with lived experience, it's kind of already built in. So they can really help inform your practices and do things like making it so that you degender all of the language that you're using on like paperwork and in processing, things like that. Yeah.
Awesome. Thank you so much for that. All right. This next question, Alyssa, I'm going to direct this one to you first. How do various intersections of identity, such as race, gender identity, and socioeconomic status, impact the experience and visibility of violence within the LGBTQ plus community?
Yeah, so I first of all, I just want to shout out to Johnny, because we had a lot of our same numbers written down, which is good because the research has been consistent, right? So yeah, the intersectionality plays a lot into it, because we're not all just one of our identities. We're all of our identities together on top of each other, and they all play into the way that we are perceived in society. So misogyny, for instance, is going to play into that pretty heavily. So, I mean, there's the expectation as a society that like violence between women isn't as serious. And so there's lesser of an sort of like a space for women to come in and be like, oh, well, this happened with a partner, but she was another woman. And there's already the view of a lot of queer women face the scrutiny of like, well, what constitutes as sex between two women? So then how can there be sexual violence between two women? And so what does that actually look like? And then like, is this something that's actually reportable? Is this something that's actually going to be taken seriously? Because, you know, I may have friends or loved ones who don't take my sexuality seriously, or the sex that I have with women as something that's actually sex. So if I go to a police station and I try to report this, is that something that they're going to take seriously? Or are they just going to look at me and go, well, that's not actually, you know, that wasn't a crime that happened, or that doesn't constitute as sexual violence. And there are certain, going back to something that Chloe stated about the way that the laws are written. So there are certain, you know, laws that are written that it's very explicit that like sexual violence is a very specific thing that is hard for someone in a queer relationship to fit into if it was indeed sexual violence. So as far as like the high rates for violence amongst queer women, and then you have as far as like the socioeconomic status. So in my work, what I do in my center, we have a program in which we service a lot of unhoused and unstably housed LGBTQ youth. And there's just sort of this survival mentality sometimes whenever it comes to people who are unstably housed or unhoused. And it's like, well, I'm just going to suffer through this sort of intimate partner violence because they're keeping me safe in some other capacity. And then it's also just kind of like, even whenever you do try to take that to the law enforcement, there's just this level of it not being taken very seriously, because it's like, oh, well, you know, y'all are just out, you know, they just that particular population is not taken as seriously as someone who is more stably housed, someone who has a more established position in their like in an economic world. And so it's harder for them to trust police officers to take them seriously. It's harder for them to feel like they can actually report anything, because they're watching their straight counterparts, you know, try and report things, and it's not being taken as seriously because they're hard to find, or it's like, oh, we can't follow up with you because we don't know where you're staying, or like maybe, you know, you were picked up or you were fined because you were intoxicated in public or something like that. So they just kind of use all these other things to take things less seriously for this particular population. So if you add being a part of the LGBTQ community on top of that, it just kind of adds an extra layer of a reason why they feel like they may not be taken seriously. And then you obviously have the race factor of the law enforcement has not the best relationship with not only the LGBTQ community, but also with communities of color. And so if you want to feel as though you're going to be safe with law enforcement, if you are a person of color who is also a part of the LGBTQ community, you are going to feel doubly unsafe. And so why would you report that? And like, why would you feel like they're going to take your side? Or why would you feel like you're going to be backed by an institution that you may not feel has been supportive of you in general? So it's definitely the LGBTQ layer on top of all of the other identities that we have, that make us feel as a society like our issues are not going to be taken as seriously, and that the institutions that are put in place to protect us have kind of let us slip through the cracks.
Thank you for that. And, you know, going back to something that you said, how sometimes they're not it's not being taken seriously, but also not even being identified as sexual assault or domestic violence. I know for a fact we've had people come through our program that said that they've tried to report intimate partner violence and were told that it's not considered intimate partner violence because it was a same-sex relationship. And so, yeah, that's definitely a barrier that we've seen with our organization. I'm sure y'all have seen it as well. Chloe, I believe you had something to say on this topic as well.
Yeah. Melissa did a pretty thorough investigation of definitely the misogyny side of it, and also race and how it plays in. I would just add like incarcerated status. So, queer people are incarcerated at higher rates, especially if they're people of color and especially Black trans women. And so if you're incarcerated, that really ties your hands on what you can do, even, how far away you can get from an abuser. And also, homelessness and poverty, because so many of us don't get a great head start or don't have any kind of intergenerational resources to draw from. A lot of us are just poorer than our cisgender and heterosexual peers. And so with poverty, you have, transportation can be an issue. Texas is not great on public transit, like anywhere. And so all of these things that are just difficult to change. Immigration status, I'm sure if people could change their immigration status, they would, because it would make life a lot easier, a lot simpler. But it's these parts of identity that we can't change that are also, unfortunately, risk factors for not being safe. Yeah.
Thank you. That actually leads us into the next question. And Johnny, I'm gonna call on you for this one. What are some of the current legal protections for survivors of sexual and domestic violence, and what changes are needed to better protect LGBTQ plus individuals, with a focus on how immigration status can create additional barriers?
Yeah, absolutely. Thanks for that question, Melissa. So when a person becomes a survivor of sexual assault, one of the best protocols, best practices would be to go complete a SAFE exam, also known as a rape kit. And a lot of people are very hesitant in doing so because it is very invasive. They're literally swabbing every nook and cranny on your body. But just understanding that the survivor should not be responsible for paying that medical bill. It is actually the responsibility of the investigating law enforcement agency to pay that bill, and that is a federal law. That's why it is really important that our survivors get assigned an advocate or a social worker or someone to accompany them through that process, just because we understand that a lot of people don't even want to seek medical help for a common code because they don't have the expenses for that. Just educating them that they should not have to pay for that. Also, legal protections for whether you're a survivor of sexual assault or IPV or both. We can start with the crime victims compensation. Each state calls it differently, but here in Texas, it is the CVC. So it is a list of, I want to say, ballparking like 5 to 8 crimes, and sexual assault and domestic violence that is on there. I think it's listed as family violence. And that does reimburse the survivor for any expenses following the assault. Relocation, loss of wages, medical expenses, and that does include mental health. We also, in the state of Texas, have the ACP program, the Address Confidentiality Program, and that is where the survivor can apply for a free PO box, and all their mail will get forwarded to that PO box, just to minimize the risk of them being tracked down by the abuser or perpetrator. Also, our lovely protective orders. I know that sometimes it can take a very long time to receive one, but that is a legal protection. And of course, we do understand that a protective order is just a piece of paper, but that piece of paper can stack charges to the perpetrator or the abuser if they continue to not only contact, but physically go see the client or the survivor. And then some barriers that we can see for our immigration community, specifically those with unknown citizenship status, is the fear of deportation. So a lot of the times we're seeing that the abuser, whether the abuser has citizenship or not, they are using deportation as a form of power and control and manipulation, so that the victim can continue to stay in the relationship. And of course, a lot of our foreign nationals or newcomers are in this country because they're fleeing some kind of whether it's lack of employment, lack of freedom, lack of justice, lack of whatever it is in their home country. So, of course, a lot of them do not want to be deported. Also, adding the fact that if children are involved, they're using that fear of being deported, being removed from your children, or even just calling CPS or a law enforcement agency against you that will possibly, result in family separation. Um, we're also seeing that a lot of our survivors are financially dependent on the abuser. And we all know that in the US, we need to have legal work permission, legal work authorization. So a lot of the times the abuser is either being paid under the table or not being paid or not working at all. So the abuser is using that as a financial exploitation and control over the victim to get them to stay. Um, and so, with that being said, it is very important that these survivors with an unknown immigration or citizenship status do understand that they are legally protected by some federal laws here in the US. The lovely VAWA, Violence Against Women Act. And I do let all my clients know that just because they have the terminology women in the act, it does not solely qualify for women only. So that federal law does provide protections to those that are victimized of domestic violence, intimate partner violence, sexual assault, rape. The list goes on and on. And they are also eligible for a U visa. And the U visa lists is like 30 different crimes. And like I said, domestic violence and sexual assault is listed on there. And then, of course, we do understand that there is intersectionality between domestic violence and human trafficking. So there's even a T visa that these survivors can qualify for. And what most people don't know is also asylum seekers. Our asylum seekers can also apply for hate crimes or bias crimes in their home country. And if they're granted VAWA, U visa, T visa, or granted asylum, that they do qualify for public benefits. Benefits. I'm sorry. Some of those being TANF, Medicaid if children are involved and listed in the petition, as well as STAT benefits. Of course, they're not just going to hand it to you. They want to create additional barriers and additional obstacles. But there are other organizations that we partner up with that can assist in appealing those and applying for those.
And just real quick, can you list what some of those organizations are?
Yeah, absolutely. So the YMCA International Services, they do a lot of international work. So they're able to help asylum seekers. They have an SAS program, which is a social adjustment services program, which is assisting those applying for public benefits. They have a refugee cash assistance program where they're also helping the asylum seekers and the refugees get some kind of financial assistance. And then Lone Star Legal Aid, they have an amazing team over there that is able to assist those appealing a SNAP denial, whether they are legal citizens or not.
Awesome. Thank you so much for that. Because I know a lot of us work with undocumented individuals and the resources are pretty thin. So it's good to know what the resources are that we can access. Alyssa, I believe you also were interested in this question. Do you have anything to add?
Johnny killed it. No, as far as anything to add, I know that like our justice system is very reactionary and not so much preventative. So it's just massively important that these that organizations like the Montrose Center and all of the listed organizations that Johnny offered, that they be accessible to these victims, because a lot of the law enforcement are going to get offer this information. And so while it's not revolutionary for me to say so. Just these organizations are doing really, really good work to make sure that these victims are getting the resources that, and if it's any kind of, for like what could do better is if law enforcement worked a little bit more closely with these organizations and offered this information up front. Because a lot of you don't know what's available to you. We have people walk through our doors all the time. So, will this happen to me? And it's like, okay, well, you can go here and you can go there and you can go to this. And it's like, well, the officer that I talked to didn't tell me that. So just making sure that like we as a community, like are referring to all of these wonderful organizations when we have people walk through our doors, because y'all are doing great work. And we want to make sure that we're getting everybody connected to the resources that are available to them.
Thank you. All right, y'all. Next question is probably my favorite one because I'm biased and I love anything education and prevention related. So for this one, I'm going to start with Joey answering. How can education and prevention programs be designed to better address and prevent sexual and domestic violence in the LGBTQ plus community?
I think a lot of what Chloe and Alyssa said in regards to how we don't really have representation in those spaces, I think that's going to be the biggest catalyst of starting that change, of creating those experiences for our community. Um, I'm I'm glad that I have the opportunity within the organization that I work with to be on the forefront of creating programs and new initiatives, and working towards other type of um, programming to start shifting the narratives and bringing people out of the disparities that come along with being a part of this community, but focusing on having those trans representation, the gay representation, the lesbian representation, and also the bisexual representation, because again, that is another community that is kind of looked upon as if they're other in some sense. So having those people in the forefront, in the conversations of creating the programs, and also too, starting to work towards back getting the DEI spaces back, because if we don't have those DEI spaces, now those people who may look up to those of us who are in the forefront working in community, they don't necessarily have a space to be cultivated. And I think that causes a lot of the issues as well.
So thank you so much. Johnny, what you got for us on that?
Yeah, just to kind of echo what Joey said, I also feel that media representation needs to play a huge role, not only with our local news stations being very transparent about what's going on in our communities, but also Hollywood. I mean, let's name some of the films we know about domestic violence. Jennifer Lopez in Enough, Julia Roberts in Sleeping with the Enemy, The Burning Bed. Like, all of these are continuously showing that domestic violence and intimate partner violence is between a man and a woman. But where's a film between abuse of a man between a man and a woman between a woman within the trans community, within the bisexual community? Media representation goes a long, long way. I would even say when it comes to our education, whether it's partner agencies giving trainings to law enforcement, giving trainings to their staff, giving trainings to their resident, it's just using more gender neutral languages, and just neutral languages in general. The abuser doesn't always have to be a male. It doesn't always have to be written out as he, him, his, or he did this, he hit her. And the victim and survivor doesn't always have to be a female or female presenting. And that also goes with, masculine presenting and feminine presenting. Also, just research. We need to do a lot of research. Alyssa and I spoke about some great numbers, but there is a lot more to do. I know we mentioned earlier on how police play a role in this. So I know a lot of the times when police are responding to a call, instead of typing it into the report as family violence, domestic violence, intimate partner violence, dating violence, they're often approaching it and documenting it as a mutual combat, just because it's two of the same sex people. And a lot of the times it's not. Like, if they do a little bit more investigating, kind of just taking their time, they will find out that there is some kind of intimate relations, whether it was current or past. And then just partnering up with LGBT community members in your area and LGBT agencies, just to see what kind of gender affirming and LGBTQ plus affirming services they can offer.
Yeah, and kind of to that point, with the mutual combat, especially if the partners are living together, I think what a lot of people don't understand is, if you look at the definition of family violence in the Texas Family Code, it states anybody in the household. which can include roommates. Now, I'm not saying that same-sex couples should be just referred to as roommates, but it still falls under that code if they're living together. So, I mean, I believe that, yes, we do need to strengthen these policies as far as recognizing same-sex couples, but it shouldn't be dismissed, especially whenever it does still fall under that Texas Family Code. So, yes, thank you for bringing that up. Chloe, what's your thoughts on this?
Yeah, y'all both gave very thorough answers. The only thing I have to add is that I would say having sort of like support groups or adult learning groups for like what do healthy relationships work, or what do healthy relationships look like, as well as just like sex education. Because a lot of us, I would say all of us maybe, we don't receive sex education that is pertinent to our experience. And so if you are going into situations where you either are expecting or might be expected to perform any sexual acts, ignorance is not a good place to be starting from. You don't know a lot of things. And so we also, a lot of us don't have healthy relationships that are like demonstrated for us as an example. And so we have to unlearn and relearn all of these, you know, norms about how to treat people. So I think that would be very helpful.
Yes, I absolutely agree with that. Alyssa, what's your thoughts on this?
So I kind of just want to add to a couple things that just about everybody has said. So just because it was just mentioned, Chloe talking about the importance of sex education and how, I mean, we live in Texas. Sex education here is pretty non-existent for any students, but so I actually pulled the statistic that LGBTQ students, 19% report having forced sex over only 6% of their straight students. So it just kind of plays back into that, like, I don't know what to expect, or I feel like I don't know what I'm doing, so I have to do this, or, you know, this is what I want, so I guess I'll just do it. Or, I mean, and then there's the possibility of like, if we're not talking to youth and young adults about queer relationships and queer sex and what that looks like in a healthy way, and what feels right for you, and setting those boundaries and helping them understand that where they can say yes and no. And it just kind of creates this situation to where you could be looking for that information from not safe spaces. So it's like, if your parents aren't talking to you about it, if the schools aren't talking to you about it, if the, you know, the resource centers are not available to you, then it's like, where are you getting that information? You know, I'm going to get on the internet and I may find somebody that may not be very safe, who's so willing to tell me, actually, let me just show you, like, let's meet up. This is not safe, you know? And so we want to ensure that like all of our youth are safe. We want to ensure that our entire community is safe, but, you know, we have to start with them when they're younger. Like, we need to start with all of our youth whenever they're younger, so that they can understand what a healthy relationship and what healthy relationship to sex looks like for them. And then I also just wanted to mention something, Joey, in talking about like the bisexual community, and how, you know, there are members of the LGBTQ community that are not in same-sex relationships, that have an opposite sex partner. And whenever you look at like the cycle of violence and the methods that are like the power structures that are put in place to kind of control whenever abusers use these systems, it's like the fear of being outed. If you are somebody who is not out to your friends, you're not out to your family, whether you're trans, whether you're bi, whether you're pan, whether you're this, that, or whatever, maybe your partner knows that about you, but your family may not. And so being in that situation to where it's like your partner is using that as a means of control, and like, how do we help combat that? And how do we help support those survivors in those situations? And then I feel like I had one more point. but it escaped me. So I will stop it there.
If it comes back to you, just let us know, because I think the rest of the questions kind of revert back to this. So
Right.
if you think of it, just let me know and we'll
Yeah.
get back to that. All right, next question. Joey, I'm going to ask you this one first. How important are LGBTQ plus community support networks in providing safe spaces and resources for victims of violence, and what can be done to strengthen these networks?
I think the biggest start of the response here is community. Um, I talk a lot with my own personal network and group of friends, and I let them know I was lucky enough to have the ability to come from a community where early on it was cultivated in me that, stand up and be prideful, stand up and reach back to your community and help uplift your community. I think because of social media and different aspects of what we're being received and what's been given to us in the multiplex or the world or whatever, we get the view of I can do all of this by myself and I don't need to have any attachment to anybody. Starting with community and really cultivating deep, lasting relationships. And in the aspect of, I understand your point of view. I know that we may not agree or the situation may not be similar, but in some aspect, let's align and learn that I can take some pieces from you, you can take some pieces from me, and we start to create what our younger community now has to look forward to and what they can start walking into. I just noticed being out in community and doing this work that sometimes when we approach them with things that aren't necessarily projected from the lens of prevention or gay, ABCDQR, all of the letters, when it's not presented from that lens, they already have this guard up because it's coming from a community worker because of the mistrust. So just starting to recultivate those relationships and really show community that no, we're here for you. We're standing in the gap for you. And also I am you because I've been there before.
Thank you for that. All right, Chloe, what are your thoughts on that?
I think Joey's right in that a lot of us come up in an environment that's really individualistic and bootstrap culture. We do live in Texas. We have very poor social support systems in Texas, both literally because of funding and also just because it's kind of a patchwork of disconnected providers. And so I think a lot of people, post COVID are recognizing the importance of things like mutual aid networks, and also just like community support and how important it is. I would say we're probably not 100% there yet, but in my personal and professional experience, I would say community networks are a lot more effective at providing people with what they need. And it's because it's coming from their peers who understand their situation. And a great example of this that I just learned about is Black Mama's Village in Austin. And they're great. They've formed like a collective where they basically took over a shopping center and they have partners in different spots, and sometimes they trade or barter services instead of paying rent, things like that. And so there's just a lot more power in numbers. Yeah.
Totally agree. All right. And Alyssa, did you have thoughts on this?
Just because I wholeheartedly agree with Joey and Chloe. That was pretty much what I had noted for my response as well. But it just also in being community service providers, kind of going off of what Joey said about like, the experience doesn't have to be the same. And it's like, you don't, as a provider, you don't have to fully understand. Like, that's not your mission necessarily. Your mission is to support, your mission is to help. And so truly just like, whenever I talk to other community partners, and like I get questions about like, okay, well, like, how do I work with like LGBTQ people? Like, how do I work with this population or like this person? Or like, I don't know how to resonate with this client. And it's like, okay, you just need to make sure that you're giving them the space and just remember your mission, and that your mission is to ensure that you're offering as much support. And, I mean, that's pretty much community service organizations, period. The bottom line is you're trying to support, you're trying to help, you're trying to uplift, you're trying to connect. And so at the bottom line, as long as you are focused on that and you're listening to the people around you that have the same lived experiences, and you're seeking that education and you're truly trying to learn and be supportive, then that's really all that you need to do. So just relying on your community and remembering that we're here to uplift and support each other and get everybody what they need.
Thank you for that. I love that answer. All right, moving on to the next question. Johnny, how do stereotypes and misconceptions about the LGBTQ plus community affect the recognition and treatment of sexual and domestic violence cases? And I think we've kind of touched on this, but I really want to go into those stereotypes and misconceptions.
Yeah, absolutely. And I'm going to just start with saying that I'm going to list some stereotypes and some things we've heard from our clients. In no way am I agreeing with that or supporting that or whatnot. So let me just preface with that. But let's just start with the belief that gay men or men who have sex with other men are hypersexuals and that they're always ready to have sex. So when it comes to sexual violence, it's always like, well, you wanted it, or you're promiscuous, like we know how you are. So that just kind of misconception and prejudice from not only the general population, but also maybe from law enforcement, the criminal justice personnel and whatnot, can also play a role in that. Also the belief that some members of the community are confused, specifically when it comes to like the bisexual community, confused as to who they like. The misconception that, oh, how can you wake up one day and like a man and then the next day like a woman? That's not how it works. Absolutely not how it works. And also, even when it comes to gender identity, there also that misbelief that people are confused. We are not confused. As a community, we are not confused. We know who we are. We know what we like. We know what we want to do. We are absolutely not confused. So let's just kind of cut that narrative, just to keep it straight up. Let's just cut that narrative. And also, like I mentioned earlier, just the treatment on how law enforcement and even possibly some of the court personnel are handling these DV and IPV cases. Stop looking at it, stop treating it as a mutual combat. It is much more than that. Do some investigative work. There's layers to it. And I'm pretty sure everybody else on the panel has some biases and stereotypes that they want to touch on. So I just wanted to go ahead and touch a little bit on that.
Yeah, absolutely. Joey, what have you heard?
I'll apply it directly to the Black community. Growing up and just being in different situations, you hear all of these colloquialisms and different things that are just like hearsay, and you heard it from a great aunt generations ago, and now here in 2024, the mindset is still the same, but nobody in the lineage has done the time to, one, get the education, to go back and start imparting that into the family, or two, we're just stuck in a situation where, well, if that's what I hear, that's what it is. Especially myself being a Black gay man who lives with HIV and has been living with HIV for 10 plus years now. The preconception was always that I was hypersexual, that I come from a background that may have led me into sex workspaces and things like that, and not knocking any of that. But if that's automatically the preconception that's there, what can we say for maybe the person who may have had an interpartner violence situation that led to them now living with HIV? That's not, reassuring for them. So just breaking those narratives and really imparting with people, like, take the time to do the research for yourself. Yes, it's okay to trust community and friends and loved ones, but at some point we have to want the knowledge for ourselves so that we can have a full grasp and understanding.
Yeah. Alyssa, what are your thoughts on this?
So just because it was just stated. I think that a lot of what Johnny and Joey, what you guys are saying is, it's all very like blaming the victim kind of situation. And it's all just very like, oh, well, that was kind of your fault. And I feel like that's very across the board with intimate partner violence and domestic violence, is that there's still the stigma of like, we're going to blame the victim in some capacity. Well, what did you do to bring it upon yourself? And I think that when it comes to the survivors being a part of the LGBTQ community, there's a level of homophobia, transphobia in that, because it's just kind of like, well, you kind of deserve that, didn't you? Or you were asking for it, or, oh, well, that's just the way that y'all are. And so it's like just reinforcing what Joey said about like, you have to kind of want that growth and that knowledge for yourself, that like, we're going to break this barrier. We're going to like deconstruct this. And then just like my own personal thoughts, I feel like what I have heard a lot is just that is whenever we have some clients come in that express any kind of like intimate partner violence with a same-sex partner, there's a lot of like gender roles that seem to play into that. So it's very much so. And then also that plays back on something that Johnny mentioned earlier about like, well, what is the representation of like intimate partner violence that we have? It's like, oh, this masculine person is hurting this feminine person. And like, that's what intimate partner violence looks like. And so it's very much so, if it doesn't look like that, even within the LGBTQ community, sometimes it's kind of like, oh, well, was it actually? And then I think that on the outside, that creates a barrier of like, okay, well, was that, it's just not taken as seriously. So deconstructing those gender roles and understanding that intimate partner violence and domestic violence does not have to look this one way. And so once we can understand that like anybody can hurt anybody and anybody can be an abuser and anybody can be abused in any kind of situation, then it will help all of the people who are being abused feel a little bit more confident whenever they're seeking help and assistance.
Thank you for that. And I have a follow-up question to this, and anybody can answer this one. A lot of the stereotypes and misconceptions do come from the heterosexual community. The heterosexual community doesn't always understand the LGBTQ plus community. However, we know that there are stereotypes and misconceptions among the LGBTQ plus community, within the community. So does anybody have any thoughts on that? Anything that you've seen from within the community?
Yeah, I think a lot of it too, just going back to the generational thing. I know there's a lot of Black gay men who have grown up in church situations who diminish their piece of the LGBT community because there's doctrine and all of this lineage of, well, I need to hold myself to a certain standard in the church representation wise. Then also too, I know what the word says and I know what biblically is put in form for us to view, and now we live that way. I think that again, giving people the opportunity to really, look within themselves, honestly, love yourself, really take a part of the community that you're in and see that there are other people out there for you, and also see that you can grow and obtain all types of skills. And the LGBT is just another aspect and another, piece of who you are, and not lead with that. I think sometimes in those stereotypes from the straight community, even within the community, we lead with whatever part of the community that we're in, we represent, and not leading with, "Hi, I'm Joey," that might happen to be gay.
Thank you. Does anybody else have any thoughts on that? Chloe, go ahead.
We keep picking up bi people, but also there is a lot of bi erasure within the community, and part of the misconception about bisexual and pansexual people is that they're hypersexual because, they're open to more than one gender. So there are people all around them all the time. Things like that. And so I think that's part of why bisexual women have 80% or so rate of experiencing IPV at any point in their lives. And part of it is that there is social hierarchy within the LGBTQ community, and it's based on proximity to power. So like cisgender people have that proximity, white people have that proximity, people that are cis passing, especially. And so it's uncomfortable, but I think as a community, in order to get to anywhere, we do need to examine that.
Thank you for that. Johnny, you had your hand up too.
Oh yeah, I just wanted to add to what Joey and Alyssa were kind of speaking to throughout this question is just the unspoken sense of internalized homophobia and internalized transphobia within the community. Like Joey mentioned, you can identify as multiple things. You can be a gay man and be religious. And it's just that sense of hearing the stereotypes and being brought up within a certain culture or within certain beliefs, and you just begin to like internalize that and kind of goes hand in hand with kind of self-hating. So yeah, I just wanted to kind of highlight and just kind of throw in that unspoken sense of internalized homophobia and transphobia.
Thank you. Alyssa, did you have anything to add?
Just that, so I think that like as far as like in the community itself, I think there's a lot to be said about certain like harmful stereotypes about like heterosexual relationships. And while some of those stereotypes may not necessarily apply to romantic relationships or sexual relationships in the LGBTQ community, there are still some that exist. And so just the personal example, something that I hear a lot as a lesbian is just like, there's almost a level of comedy that is, or it's just kind of portrayed as something that tends to happen, is like this like emotional abuse that can happen in like a relationship between two women. And it's just like almost this comical thing. It's like, oh yeah, you were like emotionally traumatized by that last ex for like 3 years. And like, she completely, devalued you and like all this. And it's like something you just kind of joke about and move on. And it's like, well, maybe we shouldn't make that like a standard. Like we shouldn't really laugh about that. And I think, it's like you try to kind of deal with things in comedy and there's like that expectation, but it's like being mindful of the way that you portray those relationships and making sure that like it's kind of going back to like the education piece, in the sense of like, we all may joke about these things. And like, if you are someone who's trying to come into your identity and trying to involve yourself in the community, you're listening to those stereotypes, you're listening to the jokes, you're listening to like the banter, you're listening to like, well, this is what all of the queer people around me are saying. This is what all of the other trans people around me are saying. And some of those things are harmful. And so while it may be that like, okay, yeah, we're all joking about it because we all experience this, there's a level of like making sure that it's understood that like, that's not actually an okay representation of a relationship, and just kind of like taking down the structure of sorry but just just like removing a little bit of the like flippant way that we talk about some of the stereotypical harmful aspects of queer relationships.
Thank you for that. All right, y'all, we are almost at time, but I do have 2 more questions and I definitely want to touch on these. So, Johnny, let me have you answer first on this one. What are some of the most urgent priorities for research, policy, and community action to address sexual and domestic violence in the LGBTQ plus community going forward?
Yeah, just like I touched upon earlier, the research people, grant funders, people in federal spaces, they love numbers. They love to see numbers. So just include us more in research, partner up with LGBTQ plus affirming agencies and that are providing LGBTQ care to the community. Partner up with us and see how we can research. We want to be able to provide those numbers. And, we're seeing the clients, we're working with them. I say it all the time. We're in the trenches with them. Like we're walking side by side with them. And then, of course, just using more gender inclusive policy and languages and terminology, whether it's in your HR policy or in some kind of documentation you have the client sign. And like Chloe mentioned earlier, invite us into these spaces. We have lived experiences. We can add a lot of knowledge, a lot of personal knowledge. So just invite us to these spaces. We don't have to be friends. I'm not going to go get Starbucks with you, but just invite me into this spaces just so I can better my community, and be a voice and a beacon for my community.
Thank you. And Joey, I believe you had some input on this as well.
Yes. Here at the Normal Anomaly, we actually are working on a research-based study with the HIV Prevention Trials Network. So having the ability to be in the research one and work directly with the community to apply back to what Johnny was saying, I think with this particular study, it's fourfold. So it's touching the doctors, it's touching the starting to build the health coalition. So it's multifold to one, start applying to the other forms that could apply to us getting into those sexual and domestic violence type of situations, and not just always throwing it to the lens of, oh, well, let's get these people tested and let's go about, getting them into prevention. Yes, we want to prevent, but there's other social determinants that come into play in that prevention, and also leading back into the conversation about domestic and sexual violence.
Absolutely agree. Thank you for that. Thank you. Yeah, I agree that we need to get more LGBTQ plus individuals involved in the actual work and in the leadership positions, and really invite them into these spaces in order to help create policy. Because we see all the time where policies are being created for individuals that don't have a voice at the table. And so I think that's something that needs to change. So thank you all so much for your answers on that. I do have one last question. This is geared towards everybody. Just real quick, what's one thing that y'all want individuals to take away in order to support the LGBTQ plus community and ending sexual and domestic violence in the communities?
I'll go. I'll say, don't be afraid to speak out. Don't be afraid to use your voice. I think, especially now in the political climate that we're in, it's most important that we get out and start using our voices and start educating our own communities. So I'll say, please, sir, please, ma'am, please, they, please, them. Don't be afraid. And I can't speak for Chloe, Johnny, and Alyssa, but if you see any of us out, definitely we have resources that are available and readily accessible to you. Don't be afraid to have those conversations with us. And two, speaking for our center, on Wednesdays and Thursdays, every week we are open until 9 p.m. for a drop-in space. So if you just need to come talk, shoot the shit, move around, get out of your normal space and kind of change your environment, we have that opportunity here for you at the Normal Anomaly. So we welcome you to our space here in Houston State Award. So yeah, thank you.
Thank you. Alyssa, what's yours?
So just as a general sort of statement, your personal growth does so much for the community. So while your personal growth, you should want that for yourself, it's ultimately going to benefit our community at large. And I don't mean our just as the LGBTQ community. I mean our as in just like people as a whole. So that personal growth, it does a lot. So don't be scared to invest in yourself. You invest in everyone else when you do that.
Thank you. Chloe, what's yours?
Donate to locally based organizations. So there are some national organizations that have like really high name recognition, but it is often the local ones that are providing direct services and could really use your funding.
Excellent point. Excellent point. Thank you for that. Yes. Johnny, what you got?
Yeah, I'd like to definitely add, the entire duration that we've been here, we've talked about the LGBTQ plus community, but I want to go ahead and, give a message to our allies, those that are standing in allyship with us, is stand in solidarity with us, be our voices in those rooms that we're not allowed to be in, be our voices and advocate for us to be receiving invitations, or just be our voices, like I mentioned before. And like Joey mentioned, the Montrose Center, we're probably the largest known LGBTQ plus resource center here in Houston. We have a variety of trainings, a variety of programs. If your agency wants HIV one-on-one, DV and the LGBTQ plus community training, even if it's technical assistance, like we are here, give us a call. We're not just here to provide direct client services. Our service stretches well beyond our clients, well beyond ourselves.
Thank you for that. I'm glad you brought up the allyship. I'll never forget this. I was in a training, I think last year, and I can't for the life of me remember who did this training with us. But one thing he said, he was talking about allyship and how a lot of people who are not in the LGBTQ plus community identify themselves as allies. However, you have to earn that title from the community that you claim that you are an ally for. So you actually have to do the work. You have to be their voice, and they have to be the ones to identify you as the ally. So that's something that I will never forget. And do y'all agree with that? It also, like
1,000%.
I was gonna say, I like the definition of ally is a verb, not a noun.
Yes, exactly. Like that hit me and it never left. So yeah, I'm really glad that you brought that up. And somebody in the chat asked, Joey, what organization do you work with? You're with the Normal Anomaly.
Yes, Normal Anomaly. We're located at 2310 Arbor Street in Houston's 3rd Ward.
Thank you. And lastly, just real quick opportunity for plugs, since I know we still have a couple of days left of Pride Month. Does anybody have any upcoming events that you would like to share for the rest of the week?
Yes, so this Saturday, one of our senior program managers, Joelle Espew, she is the female identifying Grand Marshal for Pride. So we will be at Swallow's Nest in Finn Hall at 5 p.m. tabling. Anybody that comes out and purchases a drink, some of those proceeds will be going directly to our organization. We'll be tabling. We'll have information for our upcoming Project Liberate program that'll be starting up pretty soon again, and also our healthcare navigation program that we are still working on. So come out, see the resources, come out, have a good time, and then later on that night we'll be in the parade. So we'll be throwing out things and we'll have some giveaways and stuff. So yeah.
Thank you. Anybody else?
So my organization, Tony's Place, is actually a RISE recipient for Pride 365 this year for our Craft Your Pride program, which is an art program that we run for LGBTQ high school students, in which we have a local LGBTQ artist come in and run a workshop for about 2 hours for our clients so they can come in and be creative, create a project, and then they can also get connected to the resources around the city. So we will be at the Pride 365 Festival this Saturday as well. So yeah, come see us, come say hi. And then just like Joey said, a portion of the proceeds will be coming to our organization so that we can continue to support that program.
Thank you. Chloe, Johnny, do y'all have anything?
Yeah, we are showing up at a lot of prides. So we just kind of like have a list on our social media of all of the prides around Texas that we'll be at. We're Equality Texas on every platform, and we do a lot of focus on like political advocacy. So if you follow us, you'll also get updates whenever things are hitting the proverbial fan.
And Johnny, you got anything?
Yeah, I mean, like Joey mentioned, I'm doing something else this Sunday, but some of our staff members will be at the Pride Parade. So go ahead and stop by the table, find someone with a Montrose Center shirt, whether it's a volunteer or a staff, chat with them, see what you can do to volunteer or possibly any partnerships. And then, of course, our website, we have a community calendar. And when I kid you not, there's something going on every single day on our first floor. So there's something for everybody. So yeah, I would encourage those to check out that website and kind of pop in where you want to.
Fantastic. Thank y'all so much. Thank you for everybody joining us. I really hope that y'all took something away from this and implement that into your everyday practices. If you're with an organization, implement this into your organization. I feel like this was a very insightful conversation, a very impactful conversation. And I'd like to thank our panelists one more time for joining us today. That is the end of our Lunch and Learn panel discussion. One last thank you, and everybody have a great afternoon.